So for students on the call, we have two really amazing leaders here to kind of give us some recap and some inspiration about what to do next. So we have Dr. Jim Walton. He's the president and CEO of Genesis Physicians Group. He's also a faculty member of ours. So he has taught undergrad, he's teaching graduate classes now, also teaches in our executive education program. And so he's an active role in the healthcare industry now. So he'll talk to you about, his history and really give us some good, wise advice. And we also have Dr. Keith Thurgood. Many of you maybe know him. He's the current program director of our MS Healthcare Leadership and Management program. He teaches has taught the Intro to Healthcare Management class, if you've taken him there. He also teaches the American Healthcare System, kind of the introductory level course at the graduate level, and also teaches in executive ed. So, and came from industry. He'll talk to you a little bit about his career path. So I'm going to turn it over to these two. We'll utilize chat for questions, but feel free, students on the call, if you want to show your camera, unmute yourself, ask questions, and this is really interactive. So get involved as much as you can. And so we'll just kick it off. Dr. Walton, do you want to kind of talk to us a little bit about your path towards your healthcare career, and we'll kind of get started from there. You're on mute, Sue. Sorry.
Thank you. I'm sitting on my back patio of my house, working remotely like the rest of the world. I started in healthcare probably when I was 15 or 16 years old, because my dad was a doctor and I made house calls with him. I went to the nursing home with him. I made rounds with him. I worked in his office. I ultimately worked in a lab at the hospital where he worked. So I had this kind of amazing introduction. I tell people I've been in healthcare for 5 decades. I feel like a really old man when I say that. So I decided that I wanted to be a physician pretty early on in high school, and then pursued that pretty aggressively. I went to the University of North Texas and then the Texas College of Osteopathic Medicine, where I got a degree. At the time I graduated from medical school, I was the youngest graduate in the state of Texas. I did some internal medicine training as a resident. So I'm a specialist in internal medicine and practiced medicine in Waxahachie, Texas, which is a little ranching farming community south of Dallas, about 40 miles. My wife is a pediatrician and we have 4 beautiful boys. We raised children while both of us had a career in a small town practicing medicine. Why my career pivoted during the early part of my clinical practice, when I went into practice to pay off my loans. I was always interested in taking care of the poor and the underserved, but I really couldn't find anybody to pay me for that job. So I had to pay off my student loans. So I had to take a job as a private practicing physician. Now, saying I had to take a job, I actually went into more debt to buy into the medical practice that I joined. But my passion and my heart was always to care for poor people. And so that's what I did as an avocational interest. So one of the leadership lessons is, very early in your career, find something you're passionate about. And if it's not in the job that you have, then go volunteer and create value in society that creates all kinds of positive outcomes. That's my story. About 3 or 4 or 5 years after I got involved in the community, trying to help improve healthcare, reduce health disparities, address social disparities in healthcare, we sold our medical practice, and we were a group of about 20 doctors at the time in 3 different towns. And I was also a medical director for 2 rural health clinics in Ellis County. And I became kind of the managing partner of our medical group just by default. And it was because nobody else wanted to do it, because they don't train doctors on how to be managers back when we went to medical school. So we sold to the Baylor Scott and White Health System, and they gave me a job. They hired me as an administrator to set up healthcare for the poor and the underserved for the Baylor healthcare system, starting in about 96. I did that until about 2013. Along the way, I got a master's in business administration from the University of Michigan because my boss at the time, who was a physician, says, "You don't know anything about business. You need to go get a graduate degree in business." And there was a waiting list for the UTD program. And so I went to Michigan. So it's like, because I would rather have gone locally because I lived in Dallas. But the reality is that I ended up getting into the University of Michigan. And then along the way, I transitioned after I got that degree. Someone offered me a job to run a healthcare company. So I became a CEO in 2013, and am now running two healthcare companies that are aligned with one another. One is a large physician organization of 1,500 physicians, 800 different medical practices around North Texas. And then another is an accountable care organization of about 350 doctors. So that's what I've been doing for the last 8.5 years. And my passion now is still caring for the underserved, but my second passion that I developed along the way is teaching. And I just really enjoy, I've raised 4 children. We adopted a daughter, our 5th child, and have just had a delightful time with those kids going through college. It was very expensive, as y'all well know. But I really enjoyed teaching. And so one of the things I like doing as my, outside of my job is actually contributing at this level and teaching grad students or undergrads or adults in that matter. So that's me in a nutshell. Thank you for the opportunity to share, Quincy.
Thank you. Well, so if anybody has a question, please pop in. Let's just take this chance real quick. If you could write in the chat, everyone on the call, if you can, just what is your interpretation of leadership as we kind of get this started? What is your definition or how you would consider what leadership means to you? And then as you're doing that, we'll turn the next portion of the introduction over to Dr. Keith Thurgood. You also have an interesting past that we would like to hear about today.
Okay. Well, what I thought I would do is folks are writing, their question or their idea about what leadership is maybe just, can I share something? Can I share my screen?
You can, yes.
Okay, let me see.
You're allowed.
Okay, I'm allowed. I'm a participant.
Yeah.
I'm going to do this. So I'm going to, can you see that?
Yes. Yep.
Okay. So if there's questions, you'll have to think about it or let me know, because I can't see, when you're in this mode, you can't really see what's going on. So here's what I've learned about people and leadership and making a difference at large. And as Quincy noted, I've had this, I'll call it unique. At least it's unique to me. It might not be unique to others. You might say, oh yeah, I know everybody that's done that. But what I've discovered along my professional and leadership journey is there's 2 things that you have to get right in every organization, regardless of its size. One is leaders matter at every single level of every single organization. And if you've heard me talk about this before, you'll know that one of the things that I talk about frequently is some people come to me and say, well, look, I'm not really a leader because I don't have any direct reports. And my answer to that is rethink that a little bit, because the first and most important person that you can lead is you. You are a leader, and the way that you lead, your behaviors, the things that you say influence other people, both in a team setting and in non-team settings. So that's the first thing I learned, and I'm going to tell you a little bit about this chart here. The second thing I've learned is this. Not only do you have to have the right leaders on the bus, They have to be in the right seats. You have to let people play to their strengths. But you also have to be able to develop the right strategies in any organization. Again, size is irrelevant here. Industry is irrelevant. Why are those two things important? Because most organizations that do not achieve their objectives, it's usually one of two things. One, I have the right strategies, but I'm not executing. And that is almost always a leadership problem. Or conversely, I have the right strategy, I have the right leaders and the wrong strategies. Therefore, use the leadership to drive the strategies. So those two things are part and parcel to leading organizations regardless of the size. Get the right leaders in place, and once they're in place, use them to develop and drive strategy and make it so that you can execute them. That also is underpinned by the idea that if you want to have a better organization, what do you have to do? You have to have better people. Why? Because people make up the organizations. Yes, there are systems and there are structures and there's hierarchy, but at the end of the day, people make up organizations. So to create a better organization, you must create better leaders. And that's why we talk about it all the time at both the undergraduate and the graduate level. It's so important to get that right. Technical skills are important, absolutely. But if I had to choose somebody that had great technical skills or somebody that I trusted as a leader, I would 100% of the time take somebody that I trusted as a leader. So this gets me to this chart, and I'll show you a couple of other ones here as well. So my journey, both on a professional and a leadership, has been interesting to me anyway. So I started out in the Army. I was a second lieutenant. I was stationed over in Europe, and I did a bunch of different kinds of things. I eventually left active duty and was hired by Pepsi and led a marketing company up in New York. And I commuted every Monday from Dallas on an airplane and came back on Friday afternoon. I've worked in the retail business with Sam's Clubs at Walmart, where I led one of their $15 billion business units. I've had senior leader positions in the Department of Defense, including in the Pentagon, and spent some time in Iraq and Afghanistan and some other places. But here's what I've learned, in addition to those things that I just mentioned to you. Leaders develop in different ways, both at the tactical level, at the operational level, and the strategic level. And the further you go up the chain of command, the less direct influence you have. It's mostly about influencing others to get something done. And maybe later on, we'll tell some stories on that, or you've maybe heard some of these. The other thing to note is this: organizations expect their teams to provide value. So sometimes I have conversations with some of my students or somebody that's looking for some help, and you get the feeling sometimes that the job search is all about you. And there's some truth to that. But why do organizations hire people? You heard some of this entire week. They're going to hire you because, one, you might have the technical skills that they need. Most importantly, you have the leadership skills that they need based on where they are as an organization. And thirdly, they're expecting a return on their investment. So normally we think of investment or ROI as something that from a financial perspective. And you may have had some, the economics class that I taught, or maybe a finance class that Professor Carnuta is teaching, or others. And we normally think about that in terms of just finances. But organizations also have a return on human capital. And so when you go into an organization, they're going to invest in you. And over time, as you can see from this chart, they expect you to provide value to the organization. They want to maximize the return on you. And so you learn, you grow, you develop. And by the way, you're always doing that. You're always learning and growing and developing. But at the end of the day, you need to provide some value. And that value can be measured in a bunch of different ways. It might be financial, it might be, projects that you're on, it could be patient census, it could be a bunch of different things. The point is, they're counting on you to do something to add value. And to do that, you need to be able to think clearly. You need to be able to think critically. You need to be able to take data and draw conclusions from that data. You need to be able to make recommendations and then to justify why your recommendations are important. So having said all of that, here's my best piece of advice for you right now, sitting here today. I don't know if it's my best, but it's at least a good piece of advice. Okay. Giving everything that I've just said, when you go to a meeting in any industry and you go to that meeting with a point of view, a strategy, some courses of action that you can explain and that you're passionate about, and you couple that point of view with data points and other insights, I'm telling you right now, it's worth 60 IQ points in any meeting you go to. You will be the smartest person in the room. Now, you don't want to act like you're the smartest person in the room, but you will be the smartest person in the room. And people will look at you and say, holy smokes, where did you learn to think like that? And then you can say, well, Dr. Walton taught me, or Dr. Carnuta, or whomever. Because that idea, I'm telling you, is worth its weight in gold. And how have I learned this? So here's my career path. When I started in the Army, I've had 3 big ideas that have helped me along my career path. And you can kind of see it looks like this. And by the way, this looks like it's a little bit like a horizontal or a diagonal line. It's kind of, you start at A and go to B. That's not really how it works in real life. You're up and down. You take a step forward and maybe a step backwards, 2 steps forward, a half a step backwards. You're always learning and growing and developing. And sometimes the jobs that you get will stretch your thinking. So here are the 3 things that I've learned. One is, if you really want to learn something, you have to have, at least in my estimation, 3 kinds of things. One is what I call just operational experiences. So this is leading a team, it's managing a team. It might be something very specific like a program manager, a department head in the hospital, things like that. Operational experiences that teach you about the business and about people. The second big bucket that I have is in the top right. It's around planning. So some of my best experiences that have helped me as a leader have been the idea of developing strategy, assessing risk, crafting a culture, change management, integration of teams, cross-functional collaboration, those kinds of things. And then the third thing that's helped me is on the bottom right, projects. So sometimes you might get assigned a project and you'll say, why in the world am I doing this project? It has nothing to do with my job or maybe even my interest. But what I've learned is those projects can help you be a better leader, a better manager, a better operational person. They can help you with planning. They can help you develop relationships. And it gives you different insights about the importance of things like diversity and inclusion. And those projects, even though they may not be related to anything specific that you're currently doing in your role, are important because it exposes you to other ideas, it exposes you to the organization, and it helps you find what I would call my last chart. Let's see, did I have my last chart here? I may have to come back to all that. I guess I didn't put that in here. So what you have to do is, at the end of the day, you have to find your voice, as Dr. Walton said. And finding your voice is a combination of 3 things, at least by the way I think about it. One, it's what you're absolutely passionate about. I'm telling you right now, the most productive and happy people I know are people that are passionate about what they do. Number 2, match that passion with a need in the marketplace, in the healthcare space, whatever that might be. find something that fits that. A niche, it might be a niche. It might be something very specific or something very broad. And then third, bring your skills together. So if you think of 3 concentric circles, my passion, what I'm good at, and where there's a need, where those 3 intersect, that's where you'll win. And that's where you provide value. And at the end of the day, that's what we're trying to do. Provide value to any organization to which we might land. So with that, let me tell you I guess I didn't really tell the whole story. So I've been in the Army, as many of you know, at senior levels in the United States Army. I was in combat in Iraq and Afghanistan. I've had the opportunity to lead large strategy teams like at Pepsi. I've been the president of a healthcare company. I've been the president and CEO of a CPG company and a marketing company. So I'm just telling you all that because in all of that experience, these basic fundamental things are exactly the same. So with that, I'm going to stop sharing, I think, and I'm going to turn it back over to Quincy.
Well, of that, okay, so a couple things that come to mind. You don't always know where your path will lead, and this came up all week. What you think you're going to do and what you end up doing never typically align. You might think, from the time you were a little kid and what you plan to do, but that doesn't always exactly work out according to plan. And if you have yourself open to opportunities, you'll be surprised. Something that came up earlier this week was you'll also figure out what you don't like to do. And so utilizing your time in college helps you have that opportunity where once you get a job, you can't necessarily job hop. It's not a good idea, but you can try things like internships or experiences or job shadowing or group projects to kind of figure some of that out. But I would love to hear from both of you. Was there something you tried that you didn't like?
Yeah, I think it's a great point. And I tell the students that I say this to the students who are an undergraduate with a little bit of trepidation when you go home and tell your parents this, right? So I can still remember my father, for sure was very, very clear that, that his aspiration for his son was to be a doctor. And so I never really questioned that. And part of it was I was really interested in science and STEM. I was good at it. I had a good brain. I was a nerd. So that also kind of excluded some other options. So becoming a physician was kind of a foregone conclusion in my family. I had this latent interest in, let's call history, sociology, and the issues that I was being raised in of the day that I was coming through high school and early college was the civil rights movement. And I will tell you that because that grabbed my attention in my heart, but my head was in science. You get what I'm saying, students?
Yeah.
Is that there's both. You have both. God put you together with both components. So I think what Dr. Thurgood was saying, merging those optimizes your joy in your life, in your work life. So as I went through the struggles of medical school and residency and practice of medicine and then raising a family, I became really, really clear that I enjoyed time not taking care of people in an office. I didn't like going from room to room. Y'all all been to a doctor's office. You know what it's like. Room to room to room, room to room. That's how a doctor is kind of like on a treadmill. I enjoyed making house calls. I enjoyed going to people's homes. I enjoyed sitting and talking to people who did not come up like I did, different cultures, immigrants and people of low income. I just enjoyed that. And so as a consequence, my passion, as Dr. Thurgood was saying, was fueled by how do I find a way to actually have that as a job? It's like, who will pay me to do that work? Because I'm going to be really good at it because that's what I want to do. So I went from earning a living taking care of patients, where I got paid to take care of patients, to now earning a living designing systems of healthcare for poor people. And I made a really good living doing that. And then slowly but surely, people recognize you as what's been called a subject matter expert. But I was a very narrow subject matter expert. And doctors like that, by the way. We're generally like to be specialized in very narrow things. I went to a graduate school in business who says, no, you need to be a general manager. And so they try to train me to be a general manager of all things. So that's what a CEO does. We're just kind of a general manager. A president, as Keith was talking about, is a kind of a general manager. You're not really specialized in too much of anything. But so you have to kind of deal with that, because what's natural about being general manager is that you're not considered a subject matter expert so much. You know what I'm saying? And so there's an ego issue that comes into that. So I'll stop there with those comments and let Dr. Thurgood comment, because I know he's had a lot of experience with this.
Well, first off, I really appreciate those stories, and a lot of them ring true. Now, I'll tell you just an anecdote about me, and you might think I'm a nutcase here, but I wasn't a very good student when I was in college. I was an average student, I guess. I mean, I got some, a couple of A's, mostly B's, and a handful of C's and whatnot. But here's what I learned early on. Actually, it was maybe my junior or senior year. I can't remember now. Here's the tagline. You can't cram for life. You cannot cram for life. Mm-hmm. You can't cram for the thing that you want to do. You have to develop in it. So here's the story. I go to a class and I had to take some physical science class. I wasn't as smart as Dr. Walton, so I was like in the bottom end of the scale here. And I had to take a physical science class, and for some reason I chose botany. I don't know why. Botany seemed like it. So I went to the first class, and it was one of these classes that had like 200 students in it, and it was in a tiered classroom, and I was one of 200. And the professor came in and said some remarks and then kind of left, and then the TA showed up, and on and on and on. I never went back to the class. Okay? I said, this is going to be a disaster. I never went back to the class. So when it came time for the final, what I did was I figured out when the final was, and they publish it in a catalog, and it's on Wednesday at 7:00, and it's in this room. So the day before the test, I finally got the textbook, and I read most of the textbook, at least scanned it. I had 3x5 cards. I was cramming for this test in the literal sense of the word. I was literally up all night getting ready for my 7:00 test the next morning. I go to the classroom. I sit down in the classroom with, where I thought the test was. Of course, I didn't know any students, so I didn't know who. I knew nothing, right? I didn't even know who the professor was or who the TA was. They hand out the test. I'm in my little corner. And you know how it is when you get the test, you kind of look at it and you look at the first couple of pages and you're like, okay, I think I can answer some of these questions. So I looked at the first page. I didn't know anything on the test, nothing. I couldn't even pronounce some of the words. I did it second page, third page, fourth. It was a multiple choice, 5 pages. I didn't know anything on that. I could not answer a single question on that test. So in desperation, I flipped the test over. I put my head down on my desk and I was like rubbing my, head like this, thinking, what am I going to do? I flipped the test back over, and then I noticed that this was the advanced botany test 650. I was in the wrong class. Okay. I was in the wrong class. So now I'm like, oh, phew, I'm in the wrong class. Good. I'm going to go find my class. So I looked in the catalog again, only to find out that my test, it was 7:00. All right. It was 7:00 the night before. So while I was cramming for the test, everybody else was taking it. So I ran to the professor and I said, hey, I know you think I'm a complete idiot here. I totally missed the entire exam, blah, blah, blah. And he was gracious. He said, okay, here's the exam. You can take it right here in my office right now. I think I ended up getting a C on the test, and that was my final grade. So my moral of the story is find out what you're passionate about. You can't cram for life. You can't cram for a botany test. So there you go.
That's brilliant.
Did I even spell botany right? I don't know if that's
I
right.
didn't even know.
Okay.
Don't ask me.
Okay, so students, anybody have questions at this point? Anybody want to chime in?
Is anybody taking a botany test? If you are, don't come to me for help.
I was
I
going
love
to
it.
underscore, while we're waiting on questions, I was going to underscore something you said, Quincy, that I thought was really telling, that I would not have predicted when I was an undergraduate or when I was in the college. I many students that I've run across when I was in medical school or residency, or even now, several generations later, right? Students that are in school now, I would say there's a good percentage of students who feel like that they're already that's already determined what they're going to study, what they're going to do when they grow up, you know, what their first job is going to be, and that there's not a lot of room for deviation. What I've told students in the past is that I've had 4 different full-time jobs in my career, and I started my life thinking I was going to be a doctor, right? That I was going to be somebody's doctor. That was my life definition of job. And what I learned along the way is that if you stay flexible and if you continue to learn after you graduate, and I think that's a big lesson that Dr. Thurgood's saying too, is that you don't stop learning when you graduate, when you walk across the stage, just like you didn't stop after you did high school or college. And in fact, one would argue that if you are what some people call a lifelong learner, there's a strong chance that you won't stay in the first job that you take, even if you're a physician. And I've known many people that complete professional school, like a lawyer or a dentist or physical therapist, and change their jobs, change jobs completely. So I've been a physician in private practice. I've been a healthcare system medical director. I've been a healthcare system executive, and now I'm a CEO of a couple of healthcare companies. And my last job, the next one I want is to be a teacher. At some point I'd like to be a full-time teacher. The last point, and I'll stop, is that I think that the thing that I want to tell people is, and I want to use a sports metaphor because it sometimes helps, which is oftentimes sports games, are divided into quarters. And if you think of your life as 4 full quarters, your work life, and I've divided my decades of work in my 30s, 40s, 50s, and 60s. I'm in my 4th quarter, but the 4th quarter is not even close to being done. And as you all know, if you watch any kind of sport, oftentimes the game is either won or lost in the last minute of the 4th quarter. And then finally, there's overtime. There's always a potential for overtime. You only have to look at the government to see a lot of people in their jobs in the overtime period in the 70s. So along the way, you're accumulating skills that will serve you well, maybe in the 4th quarter, but you don't even know it in your 1st quarter. So I think that's a really important thing. So don't feel like what your mom and your dad or your grandparents or whatever have kind of targeted you to start in may not be the destination. It's just how they've done a good job getting you started on your path. If you view it that way, you're going to probably be much more satisfied with the way things go, rather than thinking, oh, damn, I've missed my calling.
Love it. I
Yeah.
love that metaphor and I've seen it exactly in my own life play out like that. I think it's important too to remember that our professional experiences, our life journey is not necessarily chronological, it's experiential. And I'm going to show you one other chart here if I can that reminds me of, can you see that? So
Yep.
who's going to win? The illiterate of the 21st century will not be those who cannot read and write. Those that will be illiterate in the new environment that we're in will be those who cannot learn, unlearn, and relearn, right? That's what we have to be about. And to me, those are the best kinds of leaders. There's the best kinds of people that we know of. And they're also self-aware people, right? Nobody's as good as they think they are at the end of the day. And nobody's as smart as they think they are at the end of the day. And the way that we win is we collaborate at totally different levels.
So, okay, so students are kind of hearing your stories, and there's a student who says, Dr. Walton has totally inspired me. Another says, great advice. Okay, so we're inspired by your stories. Now what? So what do you recommend for students to leave today? What next for students as they are studying and they are preparing for life?
Great question.
What do you recommend?
Yeah, I would tell students in undergraduate, get a job. I want to see on your resume while you were going to school that you were contributing to something, whether that's babysitting, lifeguarding, anything. Just get a job. Okay, that's the first thing. And talk during your interview about the job and what it taught you and how you became one step more prepared to be a leader. Leadership is not a destination. Like Dr. Thurgood, you're leading yourself. I tell people as a CEO, the hardest job I have as a 64-year-old man is managing me and managing my attitudes and my perceptions and what I've learned and assuming what I know is truth, is absolute truth forever. And so I think the second piece of advice is have a book next to your nightstand that you read at least a page a night. Read a book. Be read. When someone asks you in an interview, what's the latest book you've read? It can't be a podcast. Okay. That doesn't mean that you're going to go old school and only read books. I listen to podcasts too. And so I'm saying don't give up on the classics. Don't give up on the historical reference points that informed how we arrived at this destination in healthcare. You dig into that, even if it's your weakest part of your game. So being a leadership, managing your leadership brand, in my view, is first, get your first job. Second is be a reader, become a little bit nerdy, if that makes any sense. Buck the trend of your generation to where everything is in a soundbite on a text message or in LinkedIn or Instagram or TikTok or whatever is your current social media affection. That I think will demonstrate to the generation that's currently in leadership that you're someone to pay attention to, because you're paying attention to what that generation's culture and currency is, so that you're not just focused in your own culture and creating and participating in the cultural divide that's between our generations. I need to reach down to you as much as you need to reach to me. Okay.
That's so smart. And I think that's, we work a lot with recruiters who are, talking with our students and interviewing and that kind of thing. And that often comes up where there is kind of this divide of culture and what students coming out of the programs now are, capable of talking about, really. And so that was feedback that we've received is if students can talk more about not even necessarily the latest in healthcare, but if they can and they know the lingo, and it's an ability to bridge the kind of the gap of people who know a lot of stuff and then students who maybe are just learning some stuff. And so spending the time to educate yourself about things that you can relate to other people. And it's not just, that was one thing, is the ability to have a conversation and make eye contact and sit across from somebody, and even just small chat or small talk, chit chat. And it's not just about what you'll gain from this relationship, or are you just going to give me a job, but do you have the ability to relate to people and to really develop and invest in relationships, was really one of the key takeaways that we heard.
I'll add my 2 cents in here, and I would call it my ABCs. And I would couch it like this. Number A is learn to add value wherever you are and wherever you land. And you do that through your formal learning, your informal learning experiences, and your on-the-job experiences. As Dr. Walton said, a job helps you add value. Why? Because you can demonstrate how you evaluate problems. You can be a good critical thinker. You can synthesize information. You can create courses of action. You can make recommendations. So what organizations need is not people just to follow, the set agenda. What great organizations need is capability and capacity inside the organization. We need you to help set the agenda, not just execute it. So that's A, is add value. B is what I would call be brilliant at the basics. And this means that sometimes to do that, you have to seek out other points of view. You have to value diversity and inclusion. You have to recognize that you're not the smartest person in the room. Because remember this, the key to human influence is to first be influenced. And in order to do that, you have to expand your circle of influence. You have to think differently. You have to recognize the value that other people can bring. So B, and what I say, C is I'm going to call it create your own leadership philosophy. So spend some time thinking about what it is that you really want to be, which underscores all of these things that we've talked about. Because once you're clear on that, then all of the strategies and actions you take will be driven towards that particular point. So create a leadership philosophy. Take some time to think about what it is that is important to you, because you will leave a legacy. In fact, right now, you are leaving a legacy. You are known for something at the university, at the place where you're employed, in your family, your communities, with your fellow students. You're already leaving a legacy. The question I have for you is the legacy that you're leaving the one that you want to leave? If it is, rock on. If it's not, then take all of these things that we've talked about in the last week in the Healthcare Summit and start to gel, start to put it on paper, start to write it down, and then start to live those things.
It's brilliant. I took a few notes here, but
yeah, I was going to comment that for the students, if you need any motivation to actually take the step and write something down, like back in the day, we would write it down and put it on the mirror where we brush our teeth so we could see it every day. Is anybody watching Ted Lasso, by the way?
yes.
If you haven't,
I don't know it.
on Apple TV, you definitely want to catch that. It's a great. It has some great concepts in there about believing in yourself. But the thought process that you need to motivate yourself is the things that we're sharing with you. Some of these key things are driven by an awareness that there are friends of yours, people your age, that are already doing it. That is to say, I'm in relationships with some of your classmates right now that are interns in my organization that just impress the daylights out of me around their curiosity, their reading of external outside the classroom stuff, their willingness to work and take classes, graduate school or undergraduate classes at the same time, their willingness to interrogate things that I say when I'm in a meeting with them. So I think that if you need any motivation at all to kind of look at this real seriously, it's the fact that the competition's very significant within the University of Texas at Dallas, as well as the marketplace at large. Oftentimes people will ask me, how do I get an internship? Well, I said, there's not a lot of them, and so you just have to be competitive. You have to, and you got to get with Dr. Thurgood or Dr. Barrett, and you got to just pound on the door and make sure that they know that you mean business. And it's not just one and done. It's a multiple. Networking is a multiplier. You have to stay at it, because sometimes people won't take you seriously. And that's just implicit bias. There's just implicit bias in all of us, and sometimes it just doesn't work out the first time. So if you need motivation, that's the motivation I would give you. And invest yourself in what you're passionate about, and give of yourself more than just your brain. Bring your heart to the table. Be vulnerable in the moment, and that might mean that people you make a mistake, or people might think that you're wrong-headed, or that you're not well educated, or whatever. But you've got to take risks in order to demonstrate that you're committed. So
Dr. Walton just used a really good word, and that is multiplier. So in life, think about this. You are either a multiplier or a diminisher, and you have a chance to be a multiplier. Another thing that might help you too is, in the undergraduate, we've got the PPHM program. And in the graduate level, we have the Elite Scholar and Leader program. And there are opportunities in both of those programs. In fact, some of those on this call today, Nancy's one, that are engaged in these very significant activities that we're working in, whether it's research or actual hands-on experience at a hospital. Number two is, don't forget, and you can go to the website and download this. You've heard me talk about competencies and the CAMI model and all that kind of stuff. So we're going through this accreditation process. As part of that, we've developed a competency model. So we have 5 domains and 23 specific competencies that we want our students to develop that underpin everything that Dr. Walton and I have mentioned today, and I suspect underpin all of the conversations that have taken place this week. So I encourage you to go off, investigate PPHM and ESLP for sure, and then download the competency booklet, because in that booklet, you get a good idea of what makes great leaders and managers in the healthcare space, and what some of the derailers are. What does it mean to be a collaborative leader? What's an example of that? And then related to that is, at least at the graduate level, we have an online, not for credit, training program that you can go access that takes all of our competency models, all of our competencies, and explains them in even more detail with video clips and recommended books and additional readings and those kinds of things. So that will help you grow and develop and mature as a professional and as a person. You're on mute.
I just did it once a day. I do it at least once a day.
Oh, yeah.
So Dr. Walton, there's a question on here specifically for you. And this is a student, she's in our graduate program. I've talked with her, and she was a practicing doctor in her own country. She's now here. And so she's trying to kind of find her space in healthcare. So she's, highly trained, and she's now wanting to get into healthcare administration. But I'm just kind of wondering, she's asking her, how does she find her niche? But I'm wondering what kind of advice you might give for people who are trying to find their space and get their footing, a little bit of a career change and yet still really connected. What advice do you have for students there?
It still goes back to passion. The fact of the matter is, I transitioned out of clinical medicine, not because I immigrated, but because I got really interested in a topic, right? Which we would call that poor people's medicine, or the uninsured, or disparities in health outcomes. But that was my driving force, and it just carried me. It was like being on the wind, and being carried away from being a clinician. Now, and number two is that I think I had an intrinsic aptitude toward system level thinking, and I leaned into that by reading and studying those topics. So but be clear, in my undergraduate training, it was all science. And I went to medical school, I was like, a 7-year kind of journey of nothing but science, and became a physician. But I think if you're transitioning out of the clinical space, and I've met with a lot of undergraduate students who get in 2 or 3 years into undergrad, and they spend most of their time in sciences, and go, this isn't really for me. It's not resonating. I don't feel passionate about doing this. It's too much a high price to pay. Then you're actually, the question I ask them is, what is your heart telling you? And what is your brain really good at? Are you more of a right brain person? Are you more ethereal? Are you more conceptual? Or are you much more left brain? And then lean into that. And there's plenty of business opportunities for both right and left brain folks. And some people, there are a few that both of them work really, really well. The little corpus callosum in between connects both sides, and they both work really, really well. So I think that it's really vital that people talk to, that are in these transition periods, talk to other folks that have gone through it, spend time listening, and then formulating what they are personally passionate about in healthcare. And so that's how I would recommend it. I don't know if that helps, but that's how I'd answer that.
Great, thank you.
But I'm happy to meet with a student, with any student. Actually, out of these conferences like I've done here, even though when I'm not teaching a class, I have students reach out, and I'll certainly sit down on either a Zoom call or face-to-face coffee or whatever, and have a chat. So that's part of my joy of education.
Thank you. Thank you. Well, we have just really a couple of minutes left. Are there any, I guess, from the student side, any final questions you want to put into the discussion? And then from our two expert speakers, any last advice you'd like to leave with the students? I think we've covered it. I mean, I really feel like students can go home. Something in another session that was brought up was, start a journal or start writing, as you all both have suggested. Start to put your thoughts out there. Maybe you'll write a book someday, but putting some things together where it's organizing your thoughts and coming up with your plan for yourself, or an action plan, or one thing you want to do by maybe it's the end of the week or by the end of the semester. So I think that kind of gelling, Dr. Thurgood, as you mentioned, putting these concepts together, and it's not just one or the other, but it's kind of all of it as they are developing. But I think we had a lot of great thoughts and conversations today.
It's been a pleasure.
All right. Well, thank you so much. We appreciate your time, Dr. Walton and Dr. Thurgood. Students in the call, feel free to, if you would like Dr. Walton's information, let me know and I can connect you. We even have an alum, Syed, on the call.
It's good
Dr.
to be
Thurgood, you're muted, Dr. Thurgood.
I was just going to say, I'm glad Syed's on the call. I didn't know that.
This is great.
I've tried to do all I can for Syed. I don't know if it's been helpful.
He's taking over the world, so it's happening. It's working.
Dr. Thurgood.
What's that?
Love it. Thank you very much for the valuable advice. It's been helpful.
Okay.
Definitely been helpful. Thank you very much.
All right.
All right, everybody. Well, y'all have a great weekend. Thank you for being a part.